mind that we're talking about when we talk about this. Mental health is a positive concept, so it's not always just the lack of things, it's the addition of things to our life. So it's about our emotions, it's about our psyche, our social interactions, meaning our interpersonal relationships. Many of you have probably heard the statistic that 1 in 5 people in Canada will experience a mental health problem or illness in any given year. But all 5 of us need to think about our mental health because it has real big implications for our physical health as well. Before the pandemic, it was kind of difficult sometimes to get our mental health paid attention to, either ourselves, our family members, or even our doctors or nurses. Short appointment times don't really lend to digging into mental health issues. Sometimes you can have a symptom of a mood disorder like fatigue, for example, that might be only looked at as a symptom of your physical health condition. And as Dr. Khan said really well in his presentation, if you've got both, we've got to treat both. If you've got a mental health issue as well as a physical health issue, both need to be treated, not just one. So across Canada and across the world, there's kind of 6 common ways we know that we can kind of think about our mental wellness. Um, Number 1 is having a sense of purpose. Number 2, strong relationships with the people we care about in our life, which leads into a sense of actually feeling connected to those people. There's just a bit of a delay. Having a good sense of self, meaning we know who we are, we know what our values are, we know what's important to us. These become things that, as you are engaging with care partners in the healthcare system, become really important to be able to communicate with your healthcare partners. It leads into the things above, how we cope with stress individually and how we enjoy life, how much we get to enjoy life, and how much that can become something that diminishes really quickly when we're suddenly coping with a diagnosis or getting a rare disease diagnosed. So, before we have a diagnosis, we've got this ongoing distress of living with unexplained symptoms, which might include symptoms like mood and behavioral changes or changes in cognition, so how we think about things. Um, as also shared earlier in the presentation, sometimes patients are left with this feeling that they might be crazy. Like, does anyone believe what I've got? Or you might hear words like psychosomatic, or maybe you've even heard the phrase adjustment disorder. We're all a little bit not adjusted well these days, so you're all in good company. So when it talks about how are we feeling, you know, Dr. Khan said, 7 to 10 years, I think, before you receive an accurate diagnosis. I saw some data saying between 1 and 5 years. I thought it was what Dr. Khan had said, unless it's changed and maybe it's different for different rare diseases. It takes way too long, basically, is the bottom line. There's not a lot of experts or specialists, so it can find really difficult to find that one expert. Sometimes we fondly refer to these docs as the unicorns out there. Um, they're really far away, maybe. Maybe they're only in the city and you don't happen to live in the city. You got to take time off work to get there. Your partners or your family members need to take time off work. There's parking and hotels, and it starts to become a really expensive endeavor. You might have gotten the wrong diagnosis or an incorrect diagnosis, and your symptoms might be getting worse in the meantime. It's not like there's a whole lot of patient-friendly information available. It's pretty high level, high science info, and that can be hard to make real in your life. And the small market size means there might be fewer treatments, um, and it can be kind of a lonely experience. So, we're not feeling so great. This leads into the data that we do know about. If 300 million people in the world have rare diseases, more than 18,000 Canadians and 2,100 Albertans are expected to have a rare disease in any given year. There's some research that's out there about rare disease patients finding that there's a significantly higher prevalence of anxiety and depression compared to the general population. Well, this all starts to make sense. And in the rare disease population, symptoms like anxiety and stress and low mood, emotional exhaustion, and suicidal thoughts have all been specifically found. Through the COVID pandemic, Cord has done some research that's available on their website that looks at what's become more salient than ever. Uh, you've probably all been told or have your own playbook, right? Like your binder that's your specific, everything you need to know, every care partner, all of the things you're observing in terms of symptoms in between patients or in between visits with your doctors. And so having this playbook readily available and even in electronic form, so potentially it, taken photographs of it, uploaded into a PDF that can be emailed around or dropped if somebody's got to go to the emergency room, so that care providers who might not even be your normal care providers can have access to that during times when services are restricted. Again, that piece about rare disease being a distinct medical specialty, if you've got to see a care provider that isn't your usual expert, being able to know how those two doctors might be able to be connected could be really important information to ask the expert about how they want to be connected. And all the ways we can help our loved ones track their condition become really, really more important. So instead of just having things written down everywhere, finding ways to go electronic apps, note-taking apps that are cloud-based, as long as privacy is respected, there could all be important things to investigate. So if you're an adult and you're the patient, you're the person themselves with a rare disease, it might seem obvious that the number one thing you can do is accept the fact that you're a patient, but it might take a really long time to be able to do that. But it's an important part of the journey in terms of allowing all of the pieces that need to come together to actually let yourself get better. Speaking up and asking questions. So, all of those moments, someone had asked earlier about advocacy. So, when you have a feeling, the feeling comes up in your body biologically for a reason. That's your nervous system kind of activating something that's going on, is the first signal or clue that something might be awry on the savannah. So you want to be able to just note that, and if you're not getting the right answer to the question, meaning the feeling hasn't gone away, that funny feeling, um, we might be able to continue to dig, find other people who can answer the question, but it doesn't mean you shouldn't ask the question anymore. Be assertive and be proactive, and that's kind of related to the thing I had said before. Being an honest as transparent as you can about symptoms. So, when you when you go see your doc and you're really excited to see them, and they're like, "How you going?" You're like, "I'm good." If you're not good, don't say that you're good. Sometimes these pleasantries in conversation happen, and presumably your specialist will go through a whole list of ways to get underneath the good part, but resist the urge to make it seem better than it is. Be prepared and keep careful records. All right. Oh, I think I lost the last one. So, in terms of strengthening coping skills, um, there's a couple of different ways to look at this. We've got coping skills that we don't know we need to strengthen until we need to strengthen them. Thinking about them in terms of the controllables. So, the controllables in your life are your intentions, your emotional presence, what you ask for, how you hold yourself accountable, how you hold others accountable, and how you decide you go about managing this. The uncontrollables, the research, the waits, the COVID delays, funding and reimbursement, the doctor's availability, the support staff, your boss, your genetics, your mother in law, your wife, your kids, their teacher, all things that are completely outside of your control. What do we do when those things become like really overbearing? That's when we need to turn to others and the relationships of the people in our lives who actually make us feel better. Being in touch with your thoughts and your feelings about the people that you're spending a lot of time with can be kind of a helpful exercise. When you leave an interaction with someone, do you feel better or do you not feel better? Who mostly lifts you up? Who mostly listens to you? Who do you mostly feel better around when you're with them? Those are some of the kinds of things that you can kind of start to be intentional about. Connecting with the right people. Um, Humans weren't meant to cope with things alone. And, you know, connecting with someone and saying that you feel vulnerable and you need help is really risky sometimes because you risk that they won't be able to do it for you. And ironically, that's what you've got to do in order to get what you need. Finding your own outlet. So being able to use creative outlets as well, whether it's journaling or music, getting that guitar off, dusting that off in whatever capacity makes sense, listening to your favorite bands. Oops. And talking to the people that make you that help you are really great. Sorry, I'm just having some back and forth. I think there's a bit of a delay, so hopefully it's not too disjointed, guys. If you do want to see a therapist, I mean, it's good to know psychotherapy actually can help with symptom management, for example. I kind of being told to exercise drives me nuts personally sometimes. I don't know how you guys feel about it. So I kind of say just move your body. Moving your body can lead to a 43% reduction in kind of days of poor mental health when versus when you're not moving your body when you can. So all these little things that you can do to help. There's a neat study that I found looking at uh, mindfulness-based stress reduction. I'm clicking here. It's not showing up yet. Okay. When it comes to comparing it to CBT, cognitive behavioral therapy for managing chronic pain, mindfulness was wonderful in observing for vitality and mental health and reducing stress, which if you're dealing with any condition that includes, chronic systemic inflammation, and your doctor's always like, you got to manage your stress. And nobody really defines exactly how to do that because, it's all stressful. Then mindfulness based stress reduction is one of the one evidence based approaches that you can look at. It's different. I'm not talking about going and, chanting or listening to a guided meditation on your Calm app. Mindfulness is actually quite distinct and really easy to do once you learn how to do it. If you feel like you don't have time to take care of yourself, which a lot of us do feel like that these days, just think small. 5-minute bursts, little micro moments throughout your day. Set a timer on your phone or on your watch that is lock yourself in the bathroom, whatever you got to do. That's 5 minutes that's for yourself. Let the light in, like literally open up your shades and let the light in and get some daylight. Get out if you can. Monitor your media consumption, especially during weeks like this. It can just be too overwhelming. Exercise or move your body however you can, whatever makes sense for you. Eat as healthfully as possible. Practicing self compassion. So, one of the things we think about perfectionism in the mental health world is a bit of a response to trauma. It's not a thing that really helps us or is helpful in a lot of ways. And if we're supposed to be reducing stressors, one of the fastest ways toward an anti-perfectionism mindset is practicing self-compassion. You can Google how to practice self-compassion, talk about it with a therapist, get curious about understanding what that really means in terms of regulating our physiological levels of agitation. One of the other things that is helpful, I mean, there's the old saying that the best laughter is the best medicine, and at times that can be really true in terms of lowering your stress levels. One of the areas I specialize in is not a rare disease, but it kind of is resourced in this country like a rare disease, and that is ADHD and mental health, so attention deficit hyperactivity disorder. Oh, my video didn't come up. Yeah, I wonder if I can make it play. There it is. And so, because it's so common, yet it's really painful and difficult to get diagnosed, we kind of call it an immersive experience. So as your anxiety and stress is being jacked up and your feeling of demoralization through the process of getting ADHD, it's a real-time experience. What does it mean to build supportive rare disease communities, especially during a pandemic? So this is about all the caregivers that are listening. So if you're the person that is, leading the ship for a family member and taking care of both yourself and other people, it can be really hard. One of the things that I don't need to tell you, but is helpful for everyone else to know is that being both a partner and a caregiver is really challenging in the same moment. So knowing that you're playing different roles, you're allowed to step in and out of different roles. And one of those roles is figuring out what you need, you as the person that's not a caregiver in the moment and not somebody's partner or not somebody's parent, just who you were before all this stuff happened. Being the online researcher and the note taker, helping your loved ones keep track of their condition. And this is like if someone has something and you're not sure if it's a symptom, you just observe it. That's the kind of stuff you can write down in the spiral and let the experts tell you whether that was something to track or not. Sometimes, you can have symptoms you're not even sure it's a symptom. Should you bother bringing it up? Oh my gosh, I just go in there and every time I go, there's like a new thing. Bring all the new things in because it's okay for your doc to be the one to help decide whether those are things we should pay attention to or not. Taking time as much as you can to schedule non-medical activities for the family. Everything in the family can suddenly be like, we're on an episode of General Hospital and everything is all about the condition, which is hard for all members of the family as much as it is for the person who actually has the rare disease. So being able to ask other people to help you do that as well could be really important. Finding your own therapist or counselor so you can have a regularly scheduled opportunity to feel your feelings and to just have some time where it gets to be all about you. Finally, you might be aware that there are stages of caregiving. Like this is a bit of a journey. There's kind of an early stage of anticipatory expectant caregiving where it's pre-diagnosis or right after the diagnosis and you're kind of geared up, you've got all the information, everyone's leaping to the occasion, and we've got our sleeves rolled up and we're ready to go. Stage 2, it's kind of referred to as the freshman caregiver, which is we've hit the ground running and we've been running and running and running, and maybe we're 1 year, 2 years out, and we're starting to have a much bigger idea of just how challenging this can be. Stage 3 is when we're burnt out and exhausted. And if we haven't at this point looked into other supports and the community and finding ways to connect and take some of the resources that are available that maybe we hadn't taken before, now would be the time. Stage 4 can be a stage of transition and loss for different reasons. It may not be an actual loss, it may be the loss of the idea that you could do it all, or the loss that we could do this by ourselves at home, or the loss and the acknowledgement of what has changed in our lives as a result of this diagnosis. So there's lots of shades to this, and being able to work your way through it, knowing it's normal to feel those feelings and healthy, could be helpful. Being in the rare disease community, no matter what role you're playing, requires a little bit of relentlessness. Fighting for equity, telling your story, making friends within the community, people who get it, people who are living the same life or a similar life anyway. Talking to policymakers, and if you don't want to be the one to talk to policymakers, supporting your friends who are willing to do that, and talking to your healthcare provider. So, you go to your doctor and you might think they know my story. And of course they know your story because they're your doctor. But being able to share the qualitative pieces about how this is affecting your life and your relationships, your dreams for the future, those are those stories that really arm, whether it's your nurse or your physician or whoever, what other care partners you might meet, like your physio, that's what allows them to have really great fuel and stories when they go talk to policymakers and they go talk to government and they go talk to pharma companies. They're advocating for you. And the clearer of a picture you get, it's just this one big chain reaction. It kind of fires everybody up. And that becomes a really important part of the journey too, moving forward. So I hope this will work if I pop it up. So you could Google these things. So Alberta Health Service has like a wonderful listing of all of the publicly funded things in the province, so the places you shouldn't have to pay more out of pocket for. So yeah, here we go. So I click on that, and then, I mean, there's loads. There's loads of all kinds of different programs, and uh, Alberta, I'm sure, as Ontario has through the pandemic dumped tons more money into a lot of these services. So hopefully that's something that is easy to find. And then if you want it and you have the means, you've got good private benefits to look for your own private therapist. Even if you Googled Alberta chronic illness psychotherapy, you'll probably hit a listing service like Psychology Today. And right here, you can scroll down. I think you can probably get specific by postal code. You'll have like loads of listings of therapists that you'll be able to see whether they're taking new clients. And almost everybody does virtual these days. So you don't even have to worry about like leaving home or getting someplace. Um, you should be able to find some services. So that's it for me. I'm happy to answer any questions. I totally went over my time, so I'm sorry. If you want to find me or look at any of our resources that we have, it's digalittledeeper.ca.
Thank you so much, Christina. I think in the interest of time, what we might do is move to a quick 5-minute break. And then if there are questions, we can maybe